Dental implants can be for anybody that's missing one or more teeth. Maybe car accident, maybe you went into the pool, got out, slipped, you hit your face and you broke your 2 front teeth, and you go to the dentist, they say, hey, they're beyond repair, they need to be pulled, then you're a candidate for implants. Other cases, severe gum disease is a big one. Severe gum disease causes loss of bone, therefore no bone, tooth stability is really bad, and then we go into implants. You know you're a good candidate for dental implants after you visit your doctor, your dentist. There's no way to know if you're a candidate or not if you don't visit your dentist. The thing is, your dentist will take a CT scan. CT scan is basically an X-ray, but 3D. Here we have a perfect representation because this is a CT scan. It was brought earlier today from a patient of ours. In this case, the patient has mobility in his teeth and he's wondering why. Therefore, if you were to see this in a picture, the patient seems to have good teeth, but we don't know the real cause of what's going on. The CT scan allows us to see what's going on. There's bone loss, really bad bone loss all around the tooth. And in a normal conventional x-ray, you would only be able to see it from a 2D perspective. Sure, there's bone loss, but is there bone behind the tooth? You can't see that. Well, here you have it. Between line millimeter 30 and 40 in this, we have it here that the tooth has movement because there's no bone around it. It's important because in a CT scan, we can see the proximity of the nerve to the tooth and if it's in front of it or behind it, and if an implant can be placed there, in front of it, or close to it without hurting it. If a patient is expecting implants, we always send them to get a CT scan. We need it. It's not something that, oh, it'd be good to have. A CT scan is necessary to get your implant done. Here we're looking at the comparison of an implant to a real tooth and how similar they are to each other. Here's a natural tooth, its natural crown, its root, and the tissue around it. Tissue remains the same. What changes is it's a porcelain crown, and then we have the implant, which would be substituting the root of the tooth. Very interesting how science has been able to imitate nature. Right here, what you see in gray is the titanium, it's the implant. In the middle here, you see the abutment, which is what connects the implant to the surface. So it's the implant, it's the abutment, and then it's the crown. In some cases, implants can be placed and an abutment can be placed immediately over it. In some instances, you place the implant, you close up the gums, you wait a few months, and that's how it happens. First come in is checkup and evaluation. Do not expect to get numb or sedated right away and put your implant in. There's a correct treatment planning to do before having your surgery done. The subject of complications is a big subject because patients may not be expecting that they may need extra bone. And how could you get extra bone? Or that their sinuses, what's a sinus, can be compromised or too close to the implant placement area. Now, this is a tricky question, but it's very important that our patients know about this. Your sinuses are basically 2 little lungs that heat up the air you breathe before it goes into your system. They are above your maxillary bone, around this area where you can see it, or if I can show you in the x-ray, it would be this area here, this dark round spots you see here. In many cases, patients who need an implant on the upper back, whatever side, sometimes they come in, they think, oh, I've got enough bone, it looks like I don't have bone loss. But once you see the x-ray, like in this case, once we pull out the teeth, in some cases patients don't have teeth anymore, but once we pull out the teeth, there's a bone loss. It's inevitable, there's gonna be a bone loss. Now, we can graft the area and that could help us with some bone, but in cases that bone isn't enough. A sinus lift is basically a procedure where we add bone into your sinus. Where and how, and is it gonna hurt your breathing? No, not at all. So basically, there's a membrane, it's called Schneider's membrane. It's like the little lung I was talking to you about. What we do with this membrane is, before messing with it, we open a little window right above your teeth. And that window, we push it up, and we find this little balloon, it's a membrane. And we slowly push it sideways. We push it sideways, we elevate it, and we lift it. There's where the word sinus lift comes from. Once we're done lifting it a little bit, we pack bone in there. We just did one yesterday. It went smoothly, 30 minutes. The patient was like, wait, you're done? Sinus lifts could, in some cases, allow the implant placement to be made immediately after the sinus lift. A bone graft is exactly what goes into a sinus lift too, except the bone graft doesn't necessarily have to be in the sinus. Bone grafts can be anywhere in your mouth, anywhere where you need bone. What do we accomplish by grafting the area of a recent extraction or an immediate extraction is to not lose so much bone. Your bone is always, every time you lose a tooth, there's a remaining space. That space is always gonna collapse unless there's something in there, and that's what bone grafts can be. Bone grafts are human bone, can be animal bone. The best is the human bone, of course, and then there's mixes of a ton. I would just trust your dentist on this one because it's science, and if you're not afraid to get human bone, go with human bone. It's a really good type of bone. An implant procedure is not painful at all. Recovery might take a while. It's not sugar and spice and everything nice, but the procedure is painless completely. This is mostly how I like to do implants and how most implants are done. The first stage is opening the incision on the gum. Once that's done, we drill a tiny hole into your bone and we place the implant. Implant is inserted onto bone just like you see here. Healing process of the bone is when you close up the gums and you let the implant in there heal for a few months. 3 months is what's necessary. Some patients have very bad bone, so we leave up to 6 months. Osseointegration takes only 3 months. Osseointegration is the process in which your bone accepts the implant. After those months are over and the implant has integrated well, you take another CT scan, which is the follow-up, making sure everything has worked correctly. We open an even smaller incision than the first time. We expose the implant and we connect an abutment to it. The abutment is basically what connects the implant to the surface of your mouth. Right here we have an image of what the implant abutment and crown look like, and it's perfectly explained in this image. We have your adjacent neighboring teeth, and we have the implant exposed now. Here's the abutment, which connects the implant to the surface, and finally you have a crown which goes right over the abutment. Honestly though, man, on a real implant, if it looks a little like that, meh. Meh. The timeline for healing of a dental implant is 3 months. After 3 months, your patient comes back and you make that other second incision I was talking about where you expose the implant, place the abutment, place the crown. The first 2 weeks of recovery are the hardest weeks where you do have to take a lot of care of yourself. The first days after surgery, or big surgery, no heavy duty exercise, not being under the sun too much, but no smoking, no drinking, no using straws, no spitting strong. And there's very many reasons for the spitting or for not using a straw. It's because blood clots. Blood clots are super important for recovery. 2 weeks of good rest is enough for your blood clot and everything to form. If you mess with your blood pressure, which is heavy activity, working out during the first days, your blood flow is gonna change drastically, which will probably cause bleeding and bad healing. Once the implant is good, is a go, it gives us a green light, it tells you it needs a crown, we place the abutment. Over that, you take an impression, which you send to the lab. 1 or 2 days later, they have your crown. And we cement the crown or we screw retain the crown. Materials of a crown can be different. It can be made out of pure metal, pure gold. It can be made out of zirconia. It can be made out of a fusion between metal and porcelain. It basically depends on what the patient wants, sometimes on looks and sometimes on budget. Different options of crowns can be from zirconia to gold. Now, every patient is a little different. Every case is a little different. Some patients, even though zirconia could be the best material, biting forces could mess up the neighboring teeth or and therefore zirconia might not be the best option for them. And then we'd probably go to metal or porcelain, something that wouldn't be so strong on the teeth. There is some other materials out there which are very good, Crystal Ultra being one of them. And if I could compare Crystal Ultra to zirconia, and I have before actually, the weight of Crystal Ultra against the weight of zirconia, strangely, it has some sort of flexibility, which is amazing. This is perfect for biting. Benefits of best material nowadays are the durability of a crown, how long it's gonna last. Why? Because of how strong it is, how resistant to biting strength it can be, which is important for the implant as well. The tooth is designed in CAD/CAM. There's milling technologies nowadays that can have a tooth done quickly, and they can be monolithic, which it means it's all done from one big piece of zirconia or metal. So implants, just like anything else, is not forever. If you get a prosthesis, if you get a disc replacement, a knee replacement, you go to your surgeon and they tell you, hey, this is gonna have to be readjusted in about 10 to 14 years. It's a thing. Everybody else that does implants, they tell them this is gonna last 5 years, 10 years. For some reason, dentistry is the only field where we're promising lifetime, and nothing made by humans is lifetime. Now this is a real thing. Our patients need to know this. Your implant could last 10, 15. There's implants that have been there for 30 years, but the normal lifespan of an implant is from 10 to 15 years. If somebody's promising a lifetime warranty on your implants, yeah, I'm gonna call BS. I'm just kidding. I'm kidding, guys. I get a lot of patients that are seeking dental implants, or sometimes they're not seeking dental implants. They come to me and they're like, hey, all these teeth on this side are messing up, and I'm changing the crowns every 2 years, 3 years. And once we look at the other side, we find out that there's no teeth. Now what's happening, all the occlusion, all the biting forces are only driven on one side. Of course it's gonna mess up. There's not a balance. There's not a stability. There's not proper function. What dental implants can do in some cases, in most cases with people that are missing teeth, is bring the correct function to your bite and what it's supposed to do. Not just bite on the right side, because these are the teeth that are good or that work. You need to be biting on the left side too, and you need to be doing it at the same time. Implants are a very good option. Implants sometimes are very necessary, but personally, we will try until we're blue in the face to save your natural teeth if we can. All on 4, all on X, is basically using 4 implants to get all your dentition back, all your teeth back. Candidates for this are patients who are missing all their teeth. You know how you've seen some people who don't have teeth and they only have dentures? Well, all on 4 is for them. You place 4 implants, 6 implants, 5 implants sometimes, depends on the bone of the patient. Here we have 4 on this image, and basically you connect the dentures to that. Candidates for this are people who can't eat anymore because they can't chew their food, or they bite on something and the conventional denture just falls off. Psychologically, not having fixed dentures, teeth that feel more natural, affects a patient in so many ways. You can't go out and smile, you can't go out and cheer at a concert because you're always afraid that your dentures are gonna fall out. Needless to say, patients who don't even have dentures, the insecurity of not having teeth, the sadness that this brings to their lives because you're not eating correctly, you can't smile. Your face is the first thing somebody sees when they connect with you as human beings. And if you're trying to not look at somebody because you're missing teeth, it's a big one, you know? Teeth are so important. Your teeth are the entrance to the soul, I would say, if I was a philosopher, but they're really the entrance to your body. Having bad teeth can affect physically the way everything else works. There's people who feel more tired just because they're not, and they don't know this, but it's just because they're not chewing properly. When you eat with a denture or with few teeth, you're not cutting your meal correctly with your mouth. Therefore, if this is not doing the job, then your body is. Your stomach's overworking to process all these meals, and then you feel more tired, and then your stomach's not gonna thank you for that. Acid reflux, you name it. The planning behind every procedure is paramount. It's substantial, it's everything. When a patient comes in, first things first, CT scan, pictures, impressions. Even though some patients are like, what do you need a CT scan for? I don't have teeth. Well, there are certain anatomical features that I need to see in order to complete an all-on-X treatment. Even if there's no teeth in there, there's nerves, there's your sinuses, there's other important stuff that your clinician, your dentist has to see. When we finally got to the last part of planning, treatment planning, and determining how many implants are to be placed and everything, the surgery happens. We sedate the patient's out of it, he doesn't remember what's going on, and we start opening just like a single implant. We open an incision on the gums, we expose the bone, and where we have planned it digitally, we insert 4, 5, 6 implants, even more sometimes, on that area. Right here we have a typical all-on-4 treatment with 4 implants about to retain a denture or a prosthesis. As you can see in this image, one of the implants is tilted, and this is done on purpose. It's because of how close the dental inferior nerve can be sometimes. So what do we do if we need this implant, instead of being here, to be back here? And why? Because it gains space. The further away implants can be, the more stability a prosthesis can have. If you have everything up front, the back is gonna rock a lot. Some cases, because of the nerve, you can't spread implants out as much because the nerve is back here. So what do? Instead of placing a tinier implant, you just incline your implant. Right here, we're looking at the implants, the abutments, which are multi-unit abutments. They remain on the implant and they connect to your prosthesis, to the denture. The screws that we have up here are to retain the denture. It's a screw retained restoration. Some procedures for all-on-4 can be done immediately after surgery. Now this depends a lot of the stability of the implant to the bone. If it's got good torque, good stability, some surgeons decide to immediately load. It's a little risky, but it can be done in some cases. If not, if there's not very good bone because of patient's age or whatsoever, 3 months later after surgery, we open up again, we place abutments and we connect the fixed denture. If we can have more implants, we can have more stability. I'll put it to you this way. Some patients can't have 6, or some patients can't have 8. All they can have is 4, sometimes even just 3. It's where there's bone. But if we can have 6 or 8, the more retention you give something, the longer lasting it's gonna be, you know? If you put 3 little studs here and you're biting on it, of course, having more friends to come support the tent is gonna be way better. There's 2 options. There's either fixed or there's snap-on dentures. The benefits of a fixed denture are above the benefits of a snap-on. It really doesn't rock at all. There's no movements. A fixed denture will have superior biting force than a snap-on dentures because there is still micro movements going on. You have to remember it's something you take off, but it's easier to remove a denture, clean around it, clean 3 little studs that you can see. I think that for me is one of the main differences. There's 2 options. One might be more expensive than the other, but which one's the correct one for you? When choosing materials, there's acrylic, the classic, the zirconia. It's strong, but I'm really excited about Crystal Ultra. It's 70% lighter than zirconia. Zirconia is a great product and a lot of our patients have it. But I think something people don't talk about in zirconia when talking about fixed prostheses is about how heavy it can be. Now you may get used to it, but once you try something like Crystal Ultra, where it's 70% lighter, it's life-changing. It's almost like wearing acrylic, but much stronger than acrylic, way stronger than acrylic. Yeah, finishing an all-on-4 is definitely exciting. It's something you've worked on not only physically, but also mentally. and also intellectually, because there was so much planning, there were so many doctors sometimes involved in this, that when it's about time to finish up the case, everybody starts calling us like, hey, remember that patient with the all-on-4? How'd it go? Show me some pictures, you know, because we all know every time there's an all-on-4, we all know the outcome is gonna be life-changing. It's the cherry on top of dental cases. It's like, all-on-4, done, delivered, patient's happy. Hey doc, wanna come eat a barbecue this weekend? Yeah, why not? Let's do it.